coming up from the Northeast Live studios in Guwahati. Northeast Tonight with Wasbir Hussain.
Hello and welcome to Notice Tonight, the show that decodes the region. The world is once again on an alert over the discovery of the new COVID variant, the Omicron. While the World Health Organization has described Omicron as a variant of concern, reports generally suggest that those hit by this variant have faced very mild symptoms like body ache, chilling, fever, etc. Many countries, including the United Kingdom, have imposed fresh travel bans and other restrictions. With India too reporting several confirmed Omicron cases, the government has come up with stricter testing measures for incoming travelers from abroad, particularly from countries New Delhi has listed as at risk. The big question is, if people afflicted with Omicron variant of COVID are only reporting mild symptoms, why is there the panic? Is the panic justified? Will existing vaccines work to fight Omicron? Is a new modified vaccine necessary? Will a booster dose of vaccine help? Do individuals or organizations have the right to comment on the ferocity or otherwise of Omicron without adequate data? How is India placed to fight Omicron? To discuss this and more, I am joined for Gurugram by Pankaj Sahu, Dr. Pankaj Sahu, Senior Consultant, Internal Medicine at the Department at the Medanta Hospital. From Newcastle in London, in the United Kingdom, I am joined by Dr. Joyanta Biswa Sharma, Microbiologist, National Health Service, UK. And I have in the studios Dr. Madhumita P. Das, Professor of Medicine at the Guwahati Medical College Hospital, and Dr. Stapana Sharma, Assistant Professor also at the Guwahati Medical College Hospital. Ladies and gentlemen, welcome to Notice Tonight. I would like to go straight to you, Dr. Pankaj Sahu in New Delhi. Dr. Pankaj Sahu, welcome to the show, Senior Consultant, Internal Medicine Department at the Medanta Medicity in Gurugram. Dr. Sahu, you have heard some of the questions. People are generally reporting mild symptoms. If this is the case, why is there so much of panic over Omicron?
Okay, so good evening, and thank you for giving me an opportunity to speak on this this is a topic of interest. And I would like to say that this Omicron virus or Omicron variant of COVID-19 started from that South Africa. And it is reported firstly on 24th of November and then 26th of November. Within 48 hours, it has declared by the WHO that it is a variant of concern. So why it is so? Because it has high transmissibility. It has high transmissibility than Delta variant, which we have earlier. And there is in this variant, of course, is a concern because the people in the Delta variant, there is transmissibility were less. And in Omicron variant, there is a high transmissibility rate is there. And it's a new variant, and we have learned from the past that any new variant, because we don't know, and this Omicron variant had 32 mutations in the spike protein. And this spike protein basically most important protein which through which the virus enters to the human cells and further infection infect other cells also. And in this Omicron variant, because there is a mild symptom, so I think there is no need to worry. And it is very easy to, it is very early to say that how it behaves. I think we need to more and more study on this Omicron variant.
Absolutely. More study is needed on the Omicron variant. It has mild symptoms. There is nothing to worry. But The only problem is that it has high transmissibility. The transmissible rate is very high. That's what Dr. Pankaj Sahu, senior consultant at Medanta, is saying. Let me go to Dr. Jayantabishya Sharma, joining me from Newcastle in the United Kingdom. Dr. Jayantabishya Sharma, once again, welcome to the show. Now, please demystify Omicron for us. What is Omicron? What do you think of its origin?
Okay, Wasbir, it's nice to be on the show. You know, just I'm joining a little bit, adding a little bit to my previous speaker's comment that Omicron is more transmissible. We do not even know that. It is not clearly established that Omicron is even more transmissible. And in epidemiological studies going on, what I have noticed in South Africa last year, end of November, beginning of January, cases were going up. And exactly we are seeing a mirror image this year as well. That doesn't mean to say that it is due to Omicron, because as my observation kind of you have understood that I am referring to a seasonal variation. Whether some of the cases, majority of the cases are attributable to Omicron, we don't know that. So there is no evidence as on today that Omicron is more transmissible. And in terms of the mutations, okay, there may be 100 mutations, 200 mutations. What is the big deal about it? The more the mutation, the more likely the virus would be unfit. There are 60 mutations in Omicron, and 10 of them are redundant. We call them redundant because those mutation doesn't mean anything in genetic terms. The 50 are genuine mutation. Out of those, 32 are in the spike protein region. Like my previous speaker, Dr. Sahu indicated, that spike protein is very important to this virus. And if this virus goes on to acquire a lot of mutations in that spike protein, it is not in its interest. It may actually become a very unfit virus. I would have been very, very worried if this variant emerged in a country where rate of vaccination is very high. For example, in the United Kingdom, we have here not only given double dose of vaccination, we actually doing booster at the moment. So very, very effective vaccine shield. So if a variant was to emerge in the UK, that variant would have been vaccine resistant. That would have been a really, really serious cause of concern.
Right.
But this variant has emerged in South Africa, actually in Botswana. The first mutant was detected in Botswana. And so I am not so concerned. It may not be a very fit variant even. Okay, so regarding his origin, I mean, there are three hypotheses going on. One is the standard thing that a viral variant usually emerges in an immunocompromised patient. A immunocompromised patient cannot fight off any viral infection effectively. He is usually given a lot of antiviral treatments, immunoglobulins, etc. And we usually see, and body is not helping. So the virus actually undergo a lot of mutations. So a fit variant can emerge in an immunocompromised patient, and then it can transmit. So that is the standard hypothesis.
Right.
And this may be true for Omicron as well.
Okay.
But there are two other interesting hypotheses. One is that it is reverse zoonosis, that it has gone to pets like dogs and cats, and got modified in cat and dogs, and then come back to human. Again, don't get very alarmed. It is the second kind of speculation. The third one is that you may have been, I don't know how much you are aware of, there is an antiviral agent called which has been trialed in South Africa. And this antiviral works by causing a lot of mutations in the virus. So this medicine was field trialed in South Africa, and there is a suggestion that there was suboptimal dose used during the course of trial.
That is a hypothesis, Dr. Sharma.
But these are all speculations.
I'll come back to you. I'll come back to you. That is the purpose. You are giving the tree hypothesis. I'll come back to you because a lot of studies are necessary because these are early days as far as Omicron is concerned. Let me come to you, Dr. Madhumita P. Das, Professor of Medicine at the Guwahati Medical College and Hospital. Dr. Madhumita, now the question is, so now we have a lot of faith in the vaccines. That's what we are being told. Now, do you think the existing vaccines which we are using as far in the Indian context, it is Covishield as well as Covaxin, do you think a person who is fully vaccinated, do you think that person has a lot to worry about this new Omicron variant? Do you think the vaccine works to fight Omicron?
First of all, it's very early to comment whether vaccinated people are showing less symptoms or overall less sick out of this new viral variant. But one thing for sure is we've all noticed that even in a country like Africa, as we have been told, where they have done only 24% of vaccination, there also the people have had less symptoms. So I would assume that over time it's going to be proved. But as of now, at the point where we stand, I feel that yes, this vaccine to a great extent is probably going to support and help us to fight out of this infection. But if time demands, the countries are ready to produce specific vaccination. But as of now, it doesn't look like it's going to be such a bad form of the virus that's going to make more and more people badly sick.
All right, slightly reassuring hearing that from you, Dr. Madhumita. Let me go to Dr. Sthapana Sharma. Dr. Sthapana, you have been specifically in charge of vaccinating people for the last 2 years. You have been overseeing the vaccination drive in the biggest hospital in the northeastern region, that is the Guwahati Medical College and Hospital. Now, a lot of people have taken Covishield, a lot of people have taken Covaxin. Now, this debate going on whether Covishield is good, whether Covaxin has more ability to fight Omicron. A lot of people are saying that a booster dose is necessary. What thoughts cross your mind? These are early days, we know about Omicron, but what are some of the things that you are taking into account?
So we have been vaccinating for the last 1 year almost. From January 16th, we had started vaccination. Yeah. We had done with Covishield, Covaxin both. And not only GMCH, Assam has done extremely well in case of vaccination. And the strategic advisory group from WHO, they have been repeatedly telling that in the next 2 or 3 weeks, they are going to comment on whether these vaccines are actually effective against Omicron, because Omicron, the mutations which have started, it's on the spike proteins where our vaccines, the antibodies from our vaccines act. So whether these 30 mutations are actually going to affect the efficacy of our vaccines. But as of now, anyone vaccinated with 2 doses of Covishield or Covaxin, which has been given by a government, we have seen that it's extreme. Firstly, I would like to again comment on this, that vaccines will not prevent the virus from entering the body repeatedly. Vaccines will only help you fight it better, even if the virus enters your body. So any person who has not been vaccinated till now, or who has been vaccinated with only a single dose of vaccine, kindly get it done immediately, because as of now, WHO has said that our strategic advisory group has also reported that it is effective.
Dr. Sahu, coming back to you, Dr. Sahu, India is currently deliberating whether booster shots should be introduced immediately, whether people should take booster shots. That's a decision that the government is currently considering, and we are likely to get an announcement sooner than later. Do you think booster shot is the need of the hour? Do you think vaccines need modification? Do you think the existing vaccines are enough?
So, well, this is very interesting questions, and I think that we need to booster dose first of all in a vulnerable category, people like who persons more than 60 years of age, and the people who they have some immunocompromised state like diabetes or any autoimmune diseases. I think the booster dose definitely will help in these people, because over the period of time, what we have seen, if the person is getting vaccine first dose or second dose, after some time the antibody titers is going down. So if we are giving any booster dose, definitely it will help. Second question is that as you asked, do we need to modify our vaccine or not? So I think that as I was just yesterday hearing Dr. Anthony Fauci, he said that maybe in future we will might develop that bivalent vaccine which will cover the Delta variant and as well as that new variant which is Omicron nowadays. It's a we are seeing. See, we need to understand that COVID-19 is like it's a flu. So as of today, as of now, today we for flu vaccine we have quadrivalent vaccine. So I think in future there will be a chances that we might see the different variant of this COVID-19 this virus like different variant like initial we had alpha, then beta, gamma, then delta, and then now Omicron. And I think in future, because it's a virus and virus nature is to change their their structure in form of mutations. So I think in future we might need to modify our vaccine.
Right, right, absolutely need to modify the vaccine. And now, Dr. Jayanta Mishra Sharma, how concerned are you really, now there are a lot of media reports where we see that, the incubation time of Omicron is very low. So you might test RT-PCR negative while boarding a flight, but when you land in the United States after 18 hours, you might test RT-PCR positive, you might get the virus. That is how fast it can transmit. So is it worrisome?
No. Nobody has said that incubation period is Omicron. Wasbir, you yourself has been repeatedly saying that we need to know more about this virus.
Yeah.
So who is that scientist who told you that Omicron's
Nobody has told
period
me.
is less?
Nobody has told me, but I have read it in the media, widely reported. Yeah, carry on.
No, I think, please don't utter that word. Let us not discuss about that at all. Omicron's incubation period, it is just a COVID strain. If it is so fundamentally different, we have to wait for that. As of today, there is no evidence that it is even more transmissible. Let us not spread any panic at all about this Omicron. Let its fundamental property be established. If it is so different, it is just a variant.
Okay.
That is my first kind of, and we have been discussing about vaccines. In the country, in the UK, I am sitting in my office today. I am in a country where we are getting 40,000 cases for last 4 or 5 months every day. Cases are hovering around 40,000. It's not going exponentially up. So I am rather outrageously, I am saying, it is an endemic disease. It is not pandemic. It is not epidemic. There is no epidemic curve, at least in the UK. And there is no curve in India or in Assam at all. 200 cases in Assam, 15,000 cases in India, divided by 1.3 million, it comes to 0.001 case per 100,000 population. And whereas I am sitting in a country, we have got 400 cases per 100 population.
And I have a question. That means, Dr. Jayanta Mishra Sharma, UK was among the first countries to impose a travel ban. A lot of people are criticizing. South Africa is criticizing you.
I think what is happening here, the UK government is taking some soft measures. It is easy to impose a travel ban. It is difficult politically to do something different, but they are taking some easy route to reassure people that we are doing something. Today they banned Nigeria. These are knee-jerk reaction. But government seem to be doing something. This is politics. You know that. If they didn't do anything, they would be in a difficult spot. So they are in a catch-22 situation. So they are rather doing certain things that are easy to do.
So
what
Dr.
is the meaning of
Madhumita,
travel ban?
Yeah, I'm coming to you, Dr. Sahu, once again, but Dr. Madhumita, I mean, from the conversations of what Dr. Jayanta Biswa Sharma is saying and what Dr. Sahu is saying, it makes a layman like me very curious. Why is it that the WHO repeatedly saying, oh, it's a variant of concern, it's a variant of concern, creating global panic? Do you think the countries are unnecessarily panicking over Omicron? Take the case of India. We have also increased restrictions for incoming travelers.
The only question, the only point that has struck my mind so far as Omicron is concerned is that till date, I don't know how much genomic sequencing have been done, but it has been reported that Omicron has doubled or quadrupled exponentially. So the fact that it has been reported in the media that there are a lot of cases within a short period of time, that is the matter that is concerning us. And that is why perhaps WHO is sending a red alert so that we can try and restrict the things. But it is not a disease that is causing life-threatening infection, and it has been till date seen to be fairly just a variant of the flu that we are suffering from.
Dr. Stapana, I want to add something, and I have also an additional question. Do you think Omicron has spread to the community? Because so far India has more than 24 cases, 30 cases, odd, whatever. But the one Bengaluru doctor who was tested for Omicron has apparently no travel history. So how do you explain this? Did he come in contact with somebody who had Omicron or who had come from outside? Or my question is simple, has it spread to the community yet in India?
Yeah, so coming to the first question, what you had asked Madhumita Madam, first thing is, when do we call it a variant of concern? WHO has given 3 points to justify a variant as of concern. So firstly, if it is of high transmissibility, if it spreads very fast. Secondly, or if that mutant, if it is highly infectious or it causes too much of seriousness in the patient, as we had seen in Delta. Or number 3 is if it is ineffective against the vaccines, or whether it is highly transmissible or if seriousness or ineffective against the vaccines. In case of Omicron, it is highly transmissible. Highly transmissible, neither it is the signs and symptoms, as I agree with our panelist, that we are yet to find out much about the variant, except that it is highly transmissible. So it has been diagnosed, so it has been given the tag of variant of concern. And any variant, any virus, I tell you, when they are in the community or when they are transmittable, they undergo mutations, they undergo numerous mutations, and sometimes they are so minute, the mutations are so minute that it's not visible, or the signs and symptoms are not visible. Only when the mutations are only when we come across this visible sign, change in the signs and symptoms, then only we call it as a variant of concern.
Okay. Now, Dr. Sahu, there are also reports which says that, for example, South Africa's National Institute for Communicable Diseases, it says that currently no unusual symptoms have been reported following infection with the Omicron variant. And there are reports which says that people who have the Omicron are almost asymptomatic, but they have sudden lung infection, and suddenly the condition becomes critical. Again, Dr. Jayanta Biswa Sharma will say that don't believe in these reports. He will tell that to me. But my point is, are there any significant signs of somebody getting COVID, and that too a Omicron variant?
So I think that this Omicron variant has very mild symptoms, only that muscle ache or body aches is there only. And then as one doctor who was treating in South Africa, then he said that the person who is getting infected, they are mostly having only mild symptoms. So still this, it is very early to say, again I will say that we need to further study, we need to see how that this variant Omicron is spreading and causing vulnerability or causing any transmissibility, infectivity, or severity to those group of people. So I think time will tell us. More research are needed, and so that we can understand that this spectrum of the clinical spectrum of the disease and severity and other things. So I think we need to just wait and then see within a few weeks, and it will tell us.
Right. I'll have to go for a break, but before that, Dr. Jayanta Mishra Sharma, what according to you are the effective way of dealing with Omicron, or you say that it's just a variant, so nothing new needs to be done? Is that what you are saying?
No, Wasbir, first of all, this variant of concern, that concern term need not raise concern. It is a naming convention. A variant, when it comes it becomes variant of interest. Then if there is sufficient reason that this needs to be kept under, there may be some, it might be of concern, then it is escalated to variant of concern. So Omicron is a variant of concern because we are trying to learn about it. Because it could be a dangerous variant, we don't know that. That's why it's a naming convention of calling it variant of concern. Tomorrow, it may be downgraded to variant under monitoring. So don't get concerned by the designation variant of concern.
Yeah, that
doesn't mean as of today we know it is more transmissible. We do not know as of today that it causes severe disease. In fact, we do know that it doesn't cause severe disease.
No.
So I think
that means
all we need to do is to monitor number of cases in India.
Right.
It is the number of cases are very minimal at the moment. Like I said, 0.001 per 100,000. In that kind of detection level, actually positive predictive value of a test diminishes almost near to zero.
Sharma,
so a positive case in an asymptomatic person in India needs to be verified twice or thrice.
Dr. Sharma, that means you have this feeling that the countries are reacting with unnecessarily, it's some kind of a panic reaction.
It's a panic reaction because the name Omicron is novel to us. In fact, it is the 15th character of Greek alphabet. That is to demystify Omicron. Omicron means the small o in Greek alphabet, and it is the 15th character. But Omicron name is a fancy name, It kind of sounds like, oh my goodness. It's nothing like that. It is like alpha, beta, delta, gamma. Yeah. It is O. So I think nobody is reacting. I mean, countries are reacting, but I think they are being careful. But we should not be raising any concern among ordinary public who doesn't understand what is mutation, what is variant of concern, what is variant under monitoring, So these are highly technical terms.
Absolutely.
The bottom line is that, let me summarize 3 bottom line. The message from South Africa is very clear. It is not causing any severe disease. WHO is on record declaring that no person has died from Omicron so far. Very clear. And we don't know it is highly transmissible yet. Why we are getting so shocked about it,
bottom line,
is
Dr. Jayanta Mishra Sharma,
in Australia, in India, in Scotland, where not.
Right.
Because it is not on the day that we discovered Omicron that it has really kind of started its existence.
Okay.
Obviously, it has been around
Dr. Jayanta Mishra Sharma,
a month or two back, and it has been spreading.
Right. The bottom line is that there is no need to panic. That's what Dr. Jayanta Mishra Sharma is saying. I'll go for a very short commercial break. Don't go away. I'll be right back. Welcome back. Let me go straight to Dr. Pankaj Sahu in New Delhi, senior consultant at Medanta. Dr. Sahu, how do you think India is placed to battle Omicron? See, now Dr. Jayanta Mr. Sharma has said, we all know that the number of Omicron, variant discovered in India, confirmed cases in India are extremely low. And there is not much of reason why we should be worrying. And overall COVID situation seems to be absolutely under control. 15,000 cases in a population of 1.3 billion is actually nothing. If I am taking the case of Assam, where we are broadcasting from right now, we have a population of 35 million and our cases are about 200 to 300 cases per day, which is below 200. So what do you have to say? Why should people still take precaution? What would you like to tell the people?
So see, I would like to, say that we should learn from the past, because this is a new variant. As earlier we had the Delta variant, and initially we were, I think, little careless, and which caused lots of devastation. It was really devastating, and lots of people, they lost their life, and even we don't have oxygen and bed for the people also. So we should not ignore this new variant. We should be very, very careful. Of course, we should not be panic, because panic will not give us anything, but we need to be prepare ourselves. So we need to prepare ourselves in terms of if it is a new variant, and the fact is that we don't know the severity, how severe this new variant is. That second thing is that the people, they should get vaccinated. So population need to be get vaccinated, because definitely as little bit that reports are coming for that the people who they are vaccinated, they are getting only mild symptoms. So I think the vaccination is important part. Second, we should not ignore it, because we are not ready, in in a very big country, and we are, of course, at some point of time, if it is going to be pandemic in India, it is again going to be a devastation.
Right.
So we need to prepare ourselves with this. We should not ignore, but we should not panic also. We need to close monitoring of this variant. And of course, again, I will say this, we need more time to understand the disease, how it behaves
Right.
further.
Right. Dr. Madhumita, one of my viewers have written to me right now saying that why is there panic, because the third wave, which was supposed to hit children, never came, at least in India. So what do you think? Are we unnecessarily bothered about it, or as Dr. Sahu said, we cannot take things for granted, we have to be vigilant?
I think the audience who wrote to you must be very prudent and optimistic. Yes, we should not panic, but at the same time, there is no point being sorry. We have to be careful. We shouldn't lower our guards. I don't think, with particularly Omicron in mind, we need to elevate anything, but it's just that we have to follow the COVID protocol. We have to believe that the vaccines will probably work, because it's yet to be proved. And since till date, the symptoms have proven to be relatively mild, and no person has been hospitalized or nobody has had anything fatal. So we are optimistic that it's going to behave like that. But as I said, we shouldn't be sorry. So let's be careful and continue with the normal COVID protocol.
So that is a cautionary note which you are sounding, Dr. Madhumita. Let me go to Dr. Jayanta Mishra Sharma. Dr. Jayanta Mishra Sharma, give us a case study. What is the situation in the UK? And I want a case study of your particular hospital. How is your hospital coping or dealing with this emergence of Omicron?
Yes, you see, it has been 2 years now. We already know a lot about COVID-19, how it is behaving. Coming to my hospitals, my region's particular situation, as I have alluded to, we have got cases about 400 per 1,000 population going on at the moment. As opposed to that, in the ICU, as of today, I just returned from ICU round. We had 4 cases of COVID patients, very mild. Nobody is dying. We got them under kind of on the path of recovering, and they will be out of ICU in no time. And overall, in my hospital, there are 60 cases, and most of them are asymptomatic, and we have picked them up by way of screening. They are not coming in with any respiratory conditions. So you see, there are a lot of cases in the community, but hospitalization is absolutely at the minimum, which I am quite pleased about and surprised too. So it is, so what is the fuss about? I don't understand. Okay, let me, being careful, yes, we always have to be careful. 1 in 6 Indian got pre-diabetes. What about that? Is it not time to think about other pressing conditions as well?
Right.
COVID is endemic. COVID is going to be with us for time to come. And mark my word, the case in India is going to go up from April next year. And we need to get our act together in terms of medical fraternity. All the private hospitals, all the government hospitals, getting their act together, not to panic, how I provide service to the patient.
Right.
There was chaos in Delhi. That killed people, not COVID.
Right.
COVID is not killing people.
No.
The chaos is killing people.
Chaos. Now you see.
The wide Delta variant.
Now
Delta
you see.
variant, which originated in India,
Absolutely.
but spread in the UK, like in thousands and thousands and thousands, not killing people.
Right.
So don't please spread the message that COVID is killing people. COVID is not killing people.
No, now you
Our
see.
mismanagement is killing people.
The point is, that is fine, but the point is what Dr. Jayanta Mishra Sharma is saying, that, not killing people, so nothing to worry. But the point is, if you are afflicted with COVID, if you have to go to some kind of a house arrest or a hospital arrest for 10 to 15 days, depending on the situation, then you might suffer from post-COVID complications. Don't you think that situation itself is a worrisome, difficult situation? Okay, you may not die, but you might have to be confined to a hospital. You might have to be confined in home isolation. You might have post-COVID complications. How do you deal with this, Dr. Stapana? Because you may not die, but you might have to face a lot of difficulties. In fact, you are facing a lot of difficulties in international travel today. You may not die, but you are having so much of difficulty. Students' education has been completely affected and gone for a toss.
See, for the last 2 years, we have been talking to COVID. We have been eating COVID. We have been doing nothing else except talking about COVID. And I agree with our speaker that when there are other causes of death or other causes of scare, whether it's non-communicable disease or other infectious disease in the community. But lately, we are only talking about COVID. And when it comes to COVID-19 or Omicron lately, I agree with my speaker, panelist, that we had been a little complacent lately, maybe. We had been visiting places, we had been we had actually lowered our guards. Exactly. So it's no harm taking those precautions back.
No.
Exactly.
Now, let me come to you, Dr. Sahu. What is it is less than 15 days since the first case of Omicron was detected in South Africa, to be precise, on the 24th of November, less than 15 days. Now, what is the WHO saying? WHO is saying something very, very basic. Even after 2 years after COVID, the WHO is saying something very basic. When as far as, there was a question, what can individuals do to protect themselves against the new variant, that is the Omicron variant? Now, what does WHO say? WHO is saying the most effective individual steps can take is to keep a physical distance of at least 1 meter, wear a well-fitting mask, open windows to improve ventilation, avoid poorly ventilated crowded spaces, keep hands clean, cough or sneeze in a bent elbow or tissue, and get vaccinated when it's their turn. Now, these are, as far as we are concerned today, 2 years after COVID, these are very, very basic suggestions. Now, does it mean that people have become overconfident because of the vaccine? Do you think that overconfidence, some kind of an arrogance has set in the world among people?
Yes. So I think that after that, introduction of vaccines, people become more and more little careless, of course, I would say. And that secondly, that most of the people, they got kind of, the pandemic fatigue. Most of people, they are fed up with all these restrictions. So it's a new term like pandemic fatigue. People, they want to enjoy their life, they want to go out, and even some people I have seen in my practice, some people even they did not go out for 1 or 2 years. So people are they are fed up with all these restrictions. But what I believe, better to be a be a in a alive then do these kind of activities once we know that this new variant is coming, and then COVID might be a fatal. So we should take this, we should follow the COVID appropriate behavior, because lots of people they are generally not following these general measures. And I think the WHO has the responsibility. They are informing time to time to us that we should be very very careful about these disease, because as my colleague speaker said, that other diseases, of course other diseases we should also talk about. But right now, see, the other diseases like non-communicable, like diabetes or the other diseases, they won't cause immediate harm. It's a very slow disease. They won't cause any immediate harm, or the life threatening. Even the people with the treatment, they are they can maintain, and they can back to their life. But the COVID something is different. We should be careful, and we should
Absolutely.
learn. Yeah.
Absolutely. I'm running short of time. Dr. Jayanta Mishra Sharma, your final comments. How do you see the road ahead now?
My final comment is that COVID is part of life. We are familiar with it, last 2 years, and it is going to go on for years to come. And next point, take home point, don't be complacent. In April, from April, May, the cases in Delhi, in Mumbai are going to go up. So get yourself prepared. Do provide good service to the patients. Reduce the hospital bill. It is a basic treatment, basic amenities, it's a basic treatment. Hospital bill for a COVID patient need not go to 5 and 10 lakhs rupees.
Right.
Get your act together. That is my second message. And take it easy. Take it easy. And do not ignore diabetes. Do not ignore non-communicable diseases. These are as fatal as COVID. In fact,
now,
COVID mortality is what?
Absolutely,
Calculate
but I don't know,
yourself.
Dr. Jayanta Mishra Sharma, I don't know on what basis you are saying that COVID is going to increase in India by April, May. That will be a matter that will be contested.
Yeah, no, that is seasonality. That is the seasonality. That I have been telling that, I am not telling on the basis Dr. Gulati is saying third wave, fourth wave. I am saying on the basis of seasonality of COVID. In India, the seasonality, if you observe, it was the, devastation, April, May, that is the time.
But
there is a
if you ask
seasonality
me,
to COVID.
but I take your point, but if you ask me, I'll only hope that you are proved wrong. Now, let me go to final comment from you, Dr. Sthapana. 20 seconds.
Yes. Firstly, is that about this new variant that has come up, we did not fear, that is out of question, but it is good to be alert, because we have yet to know about the variant, but be alert. Follow the basic rules that we have been doing for the last 2 years, and then of course we'll come out safe.
Follow the rules, follow the basic rules.
Exactly.
The final comments, the last word to you, Dr. Madhumita Pidas.
I personally believe that COVID was a pandemic. It's become an endemic disease now. Just as we have learned to live with tuberculosis, we've learned to live with HIV, we've learned to live with Japanese bee encephalitis. Similarly, we have to follow the protocol of prevention, vaccination, tracking the patients once there are symptoms, and live a life with COVID, because it is going to be with us for ages to come.
Well, that's a very interesting way to conclude. COVID has transformed from being a pandemic to an endemic. We have to live with COVID. That's what Dr. Madhumita has said. Most of us agree with that. We have to learn to live with COVID, but learn to live with the COVID appropriate behavior as well. Prevention is important. Vaccination is important. We have to live the life. The show must go on, but we cannot throw caution to the winds. We have to be careful. That is the bottom line, which not just WHO, that this is basic common sense now. Everybody has become COVID educated, at least in India, and we have done very well as far as our vaccination is concerned. There is no need to panic. That is the bottom line of this discussion. I thank all my panelists for participating in the show and the viewers for watching the program. Good night and goodbye.